안녕하세요.
Hello, I'm Professor Chung Jae-en from the Department of Periodontology at Seoul National University, Gwanek Dental Hospital. Today we'll review a case of implant placement in the posterior maxilla, along with a sinus graft via the crestal approach. The patient is a 68-year-old male with missing teeth, number 15, 16, and 17. As with most patients, the maxillary sinus was pneumatized, and the bone quality was relatively poor. On this panoramic radiograph, you can see where we are planning to place the implants at sites number 15 and 17. On the clinical photographs, fortunately, the ridge width and keratinized gingiva are sufficient, and both the quantity and quality of the soft tissue appear adequate. When placing 2 or more implants, I usually use a one guide for placement. So, we first designed the one guide. At site number 15, there is no sinus involvement, so the implant can be placed directly without bone grafting. At site number 17, there is approximately 4 to 5 millimeters of residual bone, so grafting will be necessary for the remaining area. However, the ridge width appears to be sufficient. When the one guide is fabricated, the surgical report shows the distance from the bone crest to the sinus floor in millimeters. With this information, we can perform guided surgery more safely and efficiently, using tools such as the one-cast kit. So, the treatment plan was to place the implants using a one guide. As mentioned earlier, the ridge width was sufficient, and the thickness and width of the soft tissue, as well as the amount of keratinized gingiva, were adequate. So we planned a flapless surgery. For site number 15, a 4.5 by 10 millimeters Osstem implant was planned. And for site number 17, a 5.0 by 10 millimeters or 5.0 by 8.5 millimeters implant was considered. At site number 17, because of sinus pneumatization, a sinus lift with bone grafting was planned. We planned to elevate the membrane using a hydraulic technique and perform crestal approach using the one-cast kit from the one guide system, along with osteotomes. Now, let's watch the surgical video.
여기까지 나갈게요. 거예요. 6mm짜리요. 3.1mm. 좀 다시 잡아드릴게요. 잡아드릴게요. 저 앞에 앞쪽문에 뒤에 우에 살짝
Now that we've watched the video, I'll first show you the postoperative panoramic radiograph. As planned, implants were placed at sites number 15 and 17. The bone quality turned out to be poorer than I had expected from the CT scan. At site number 15, a two-step under-drilling protocol was used, and an Osstem TS 4.5 by 10 mm implant was placed. At site number 17, a one-step under-drilling protocol was used, and an Osstem TS 5.0 by 8.5 mm implant was placed. As you may have seen in the video, for site number 17, we used the one-cast kit and gradually progressed from 4 to 6 mm. While drilling, I first checked for sinus floor penetration with the 4 mm drill, then checked again with the 5 mm drill, and proceeded to the 6 mm drill. By repeating this process, sinus elevation was performed. Here are the post-operative photographs. Since the quantity and quality of the soft tissue were good, this flapless approach resulted in little to no patient discomfort. Despite the sinus graft, healing was very rapid, and patient discomfort was minimized. Here are the preoperative and postoperative panoramic radiographs. Using osteotomes with the one-cast kit through a crestal approach, a relatively wide sinus elevation was achieved. I hope this online surgery case using one guide and the one-cast kit for sinus elevation was helpful. Thank you for watching.